Hi, my name is Jacob Adams, athletic training student at Adrian College, and you have been referred to watch this injury education video on patellofemoral pain syndrome. So what is patellofemoral pain syndrome? It is a generalized term which encompasses many different pathologies to your anterior knee, um, otherwise known as your patella or kneecap. This is a chronic pain, so it happens over a long period of time. Very common amongst the young population, particularly in female athletes, and is caused, or etiologies caused by overuse. So sudden changes in this fit principle being the frequency, intensity, type, and time. Sudden change in any of those things in your exercises and or activities of daily living. Also caused by a malalignment, which I'll describe in detail. So the clinical anatomy, important anatomy to understand of this injury, is that the patella pain is, or the patella is anterior to the knee, as shown to the image in the right, exterior of the joint capsule, and it's held in place by the patella and quad tendons, as shown in the right, and not shown. Also, it is held by the medial and lateral patellofemoral ligaments. Also, the patella is within the trochlear groove, as shown in the image on the bottom right. However, despite these structures, the patella is still very unstable. So, some signs and symptoms of this injury are signs being things you can see. You could see that your patella is tracking outside laterally, possibly increased or large Q angle. Q angle being the angle from your hip to your kneecap in proportion to your lower leg. So as shown to the image in the image on the right. Also decreased range of motion, so you're unable to flex your knee or bend your knee as far as you could before, and decreased function and ability. Symptoms being pain underneath the patella, particularly during squatting or excessive knee bending activities. Say for instance, like being a baseball or softball catcher. And also other symptoms being knee buckling or instability. So my main focus of this informational video is just focus on ways in which non-operative, so without surgery, in which you can rehabilitate this injury, being exercises. Several exercises you could do are some quad strengthening, as shown before with the quadricep tendon inserting on the patella, strengthening those muscles will help regain stability of the patella. Also core stabilizing, as relevant to the hip, with strengthening the core, it helps stabilize the hip, thus stabilizing the knee further. Also, orthotics or proper footwear can be worn and used to help create stability of the foot, thus stability in the knee. Also, stretching of the tight structures laterally pulling, as the quadriceps are stronger on the outside or laterally than in the medial or inside. Thus, stretching these structures will help regain stability within the kneecap. Also, just remembering to have gradual changes in any training or activity. Just remembering that fit principle, frequency, intensity, type, and time. And also the use of social support, knowing that using your friends, families, and coaches and other close peers to help you throughout this rehabilitation process. And most importantly, as it being a chronic or overuse injury, is to rest and limit yourself in knee flexing or bending activities. So in conclusion, this is a common injury. Most overuse and malalignment are the causes. Just remember to follow the rehab guidelines, so just doing the exercises and stretches appropriate in order to see results of decreased pain. Using that social support from your friends and family and healthcare providers, and with After watching this video and following the rehab guidelines, if symptoms and signs and symptoms do not improve or worsen, consult your doctor for future additional recommendations. Thank you for watching this video. Bye.